All right, now joining me now, Dr. Massand. She is a primary care physician. Dr. Massand, thank you for joining us today.
Thank you for having me.
So, this has been an interesting couple of days. There's some news that came out about this drug called remdesivir today. That's the big news that's been coming out. What can you tell us about this that is the first real positive sign that we don't have a cure, it sounds like, but we do have potentially an effective treatment, correct?
That is correct. So there was information that came out today about a clinical trial held on this medication remdesivir in treating coronavirus. What it's showing is that there seems to be a decrease in the number of days that patients are infected or show symptoms with corona, though it has yet to show some improvement in mortality. So there's definitely more to come on that, and more studies will be required. But this was a good-sized trial involving about 1,000 patients.
That's good, so we can wait for more information down the road. And there was some information that came out this week about this, the active ingredient in Pepcid. And just before, so we warn people, it's not the Pepcid that you would take orally. From what I understand, this is something that you take intravenously, so don't go out and buy a bunch of Pepcid. But what have we seen from this potential breakthrough with Pepcid?
So, not necessarily a breakthrough, but there was a study that came out that showed patients who were hospitalized who had been on doses of famotidine, which is the active ingredient of Pepcid, showed some slightly decreased rate of mortality. And so currently, again, there is another trial that is happening with IV famotidine. And so this is not something, again, that we would utilize as an over-the-counter dosage, but in much higher dosages and still under clinical trials. So there's definitely more to come on that.
Mm-hmm. It sounds like there was a lot of things still in the pipeline, but unfortunately we're all so impatient about going outside and doing something. We're sort of grasping at straws still a little bit here. So one of the things we've been talking about a lot is testing for the virus, testing for the antibodies. What have you seen in your practice so far? Are you able to get the testing you need? Have you seen success with testing for the antibodies? We've heard some sort of mixed results when it comes to testing for the antibodies.
So I'm part of Advantage Care Physicians, and we are a community-based practice. We have 38 offices all across New York metropolitan area, New York City, as well as Long Island. So we do have testing available for our patients, for our staff, and we are doing two kinds of testing currently to assess for active infections. One is the PCR test that goes to the lab, and it is a nasopharyngeal swab. And the other one is a point-of-care test, which we are doing in the offices, which can give us a result within 15 minutes. So those are the tests that are being done to assess active infection. The other kind of test that you are referring to is the IgG antibody test that helps test for the antibodies generated inside a human being when they are infected with the virus. This IgG antibody starts accumulating or forming inside the body after at least 14 to 21 days past infection. So that will determine whether or not a person is immune or has developed some immunity after having been infected with the coronavirus. Again, that immunity is not guaranteed, and we still do not know how long the immunity will last once a person develops the IgG antibodies. So again, there is testing that needs to be done, but IgG antibody testings are now being made available to our patient population.
So that was going to be one of my questions, because it's been this sort of question that's hung over this whole thing, is that we have assumed that there is some immunity once someone recovers from this, but it's been unclear whether we have that. There's been some, anecdotal cases, it seems like here or there, that maybe someone was infected twice, but it's not clear. Where do you stand on whether, if someone legitimately has been infected and then recovers, if they have some immunity down the road?
So definitely the IgG antibodies confer some form of immunity. And you're right, we do not know yet how long this immunity will last. So there are illnesses that you have once in your lifetime and never again will get it And then there are illnesses just like influenza. You may develop temporary immunity, but then again, next season, you may have to be reimmunized because you need to be, because the IgG antibodies do not confer long-term immunity. So we have yet to see what kind of effect this IgG antibody in coronavirus infected patients, what kind of immunity this antibody will confer. We haven't had enough time to be able to understand the long-term immunity that our patients will have after getting the virus.
Mm-hmm. So what do you take then from, it came out this week that we tested, there was a big survey done of about 3,000 people, and it found that maybe about 15% of the people in the Hudson Valley, a little higher in the city, a little lower upstate, have had exposure and have had some, or show some signs of having those antibodies. Is that good news that we have that high of a number, despite so many people, it seems, having been exposed and then having really no idea that they were sick? If we have that high of a number, is that good news or is that bad news?
So there's both components to it. So what this shows is that there is obviously a larger percentage of the population that is getting the infection. But the good part about it is that it means that there's also a larger percentage of the population that is not showing that much symptoms. So they are either having minimal to nothing symptoms. So that's the good part of the news. Understanding how many people in the community have the IgG antibodies will help us determine where we stand with allowing some of these folks back into the workplaces. Also, when we talk about herd immunity, we need to have a certain number and a certain percentage of the population who develop the antibodies to say it's safe because these patients or these people will not carry the virus. Also, having the antibodies and a significant percentage of the population with the antibodies will break the chains of transmission. So this can be looked at both ways, good or bad, but the tests still need to be done to understand what level of immunity is required, what level of IgG antibodies are required to confer the immunity, and how long will this immunity last? Those questions have yet to be answered.
Yeah, and I'm going to follow it up with a question that you may not know the answer to related to that, which is going forward, there's been a lot of talk about perhaps another wave coming in the fall. Would this potentially help blunt that wave because enough people, assuming that this 15% goes up over the next few months, would that perhaps blunt that wave so this second wave that we're expecting is not quite as large as the first?
So it's hard to say again what and when will the next wave be of infection. That wave can be a little sooner if we do not follow the social distancing rules, if we open up the states and the businesses too early, too quickly. If we continue to follow the rules about social distancing, we may be able to do it slowly develop enough people in society with the antibodies that prevents or blunts the second wave. It may not prevent the second wave, but it can definitely blunt it.
Mm-hmm. And so how do you feel about how New York has handled this so far as the social distancing, closing down the economy? We've had some other states now, mostly states in the South, that are opening back up again already. Do you expect to see them spike in the next week or two? Are we doing the right thing here? Are you, how do you feel about the two ways that different states are handling this?
So the recommendation is that the states show and communities show a consistent drop in the number of new infections per day. And some of these states may be opening up businesses a little sooner than those 14 days required. The truth is that there will definitely be some spike again once people start to go out into restaurants, into businesses, more workers go out and open up shop. So there will be some spike, but that's where, as Governor Cuomo stated earlier today, that's where we have to be very nuanced and very nimble in our approach. We have to see upward trends happening. And if the upward trends start to happen, then we have to pull back again. And again, go back to being a little stricter about keeping some of the businesses closed, not reopening too quickly. So this will have to be taken week by week, day by day, county and state by state.
All right. Dr. Seema Massand, thank you for joining us. We're going to take a quick break, but we'll be right back with more questions and answers about the coronavirus. And welcome back, everybody, to our coronavirus pandemic special report. I am joined tonight by Dr. Seema Massand. She is an internist, a family primary care physician. So I wanted to ask you, Dr. Massand, there's so much we still don't know about coronavirus. We just talked about that a minute ago. We don't even know if we're truly immune to it or for how long once we've been infected. But what have you learned about the coronavirus that, say, we didn't know even a month ago or even a couple weeks ago?
So this virus has behaved in a very, in a manner that it caught us all off guard. Came right out of nowhere, has come up with many different symptoms, is affecting us very differently. Initially, it was thought that it's not going to be affecting children, but now we are seeing some reports coming out of children being affected in different ways. It's affecting many different organs. People are developing very severe symptoms also. So it's taught us a lot of lessons. It has us scrambling to look for treatment and to look for prevention.
You just talked about some of the curveballs this thing is sent. I've heard that one of the things that it's been happening to younger people is that it really affects the blood supply. I've seen stories that young people are dying because it's causing clots. Are you seeing that? And there's also evidence that it's causing the opposite in some patients and making their blood even thinner. It just sounds like, it's sort of this problem that seems to have no solution.
That is true. A lot of the infections that were initially considered to be pneumonia in the lungs and or ARDS is a consequence of multiple small clots in the lungs. And so patients are getting sick and have to be put on the ventilators. So there is definitely many different ways this virus is presenting in the body. And like you said also earlier, that because of the immune response in the body, there is sometimes excessive bleeding. There is incidence of stroke happening. There is myocarditis, which is infection of the heart muscle happening. So it's affecting us many different ways.
You really got your hands full trying to stop this thing. And one of the things that goes with this, I don't know if you've seen in your practice because you're not in a hospital setting, but we did lose an ER doctor this week, and it sort of has seemed like we knew that a lot of medical professionals were being stretched to the limit, and that doctor may have been a canary in the coal mine. What are you seeing amongst your colleagues, and are people taking the mental health aspect of this more, on the medical side, now that you've had one tragic suicide, and it's likely that others are, feeling the weight of all of this pressure of trying to treat all these patients?
There's definitely an impact, not only on the general population, on the patients, but also on the healthcare providers. So behavioral health symptoms of depression, anxiety, sleeplessness, worry. There's young families being separated because a mom doesn't want to go home from the emergency room and touch her little children. So it's taking a toll on a lot of people. And this was a very sobering situation that happened earlier this week. And we also at Advantage Care Physicians, unfortunately, have lost a couple of our colleagues to this virus, and that has also been a very sobering time for us. We are here to support each other. We also are providing this kind of support in our offices to our staff members, to our physicians, as well as to our patients. And virtual visits is the way of providing this care now in this new environment. So very early on, we learned that we needed to switch gears. So at Advantage Care Physicians, we quickly adapted to providing telemedicine through virtual visits. And our therapists, our social workers, our psychiatrists also are part of the workforce that are providing this care to our patients.
So you are not actually having to see a lot of patients one-on-one at this point?
We are still seeing patients in person in the office, but we are limiting that to urgent needs. What we are doing mostly is virtual care, and a lot of this initially was COVID-related symptoms. People were calling in, needed to be seen, and again, to make sure that we are not asking people to just come into the offices unnecessarily, posing a risk to themselves and to others. Virtual environment was the best way to go. Now we have also started providing care to our chronically ill patients, patients with other comorbidities, patients with diabetes, hypertension, who need to have their routine care taken care of. So we cannot postpone that. Our patients need our our patients need monitoring, they need their medications, they need their tests to be done. So we are doing those through chronic disease management, also virtually.
We just have a few seconds left here, about 30 seconds, but what are you telling your primary care patients who are concerned about what to do next?
Maintain social distancing. Whenever you go out, wear a face mask. A cloth mask is fine. Wash your hands as much as you can. Use sanitizer with at least a 60% alcohol percentage in that. Thing to do for yourself and for others around you.
Okay, Dr. Seema Massand, thank you very much for that. I tell you what, we're going to take one quick break, but we'll be right back with the doctor and more of your questions coming right up. Welcome back to our special on coronavirus. I am joined tonight by Dr. Seema Massand. She is a primary care physician. And Dr. Massand, thank you again for joining us. You know, it's something that came out, I think it was just yesterday, that it looks like this family, either the family infected the dog or the dog infected the family. And it seems like it would be the family responsible for this. But are we seeing more of this, that yes, we could even infect our pets?
So the likelihood is, obviously, we are spreading the infection from one human to another. There have been some situations where humans have transmitted the virus to cats. Dogs seem not to be such a great host for this virus. Dogs are not building up enough viral levels or loads in the body to actually show infection. So there may be a possibility, but the likelihood of our pets getting the infection from us is less. And just like we would do social distancing with each other if we are symptomatic, maintain distance. So just like we would do it from the rest of our family members, our pets are our family members, so we should maintain our distance from them if we have any symptoms.
So just to be clear, it looks like we can infect our dog, but for some, just for some reason, dogs are not as susceptible to getting really sick.
Mm-hmm. That is correct.
All right. Well, Dr. Seema Massand, thank you for joining us today. A lot of great information out there, and we appreciate you joining us.
Thank you for having me.